Chickenpox and shingles are caused by the same virus, that's varicella or herpes zoster. And humans are the only source of infection for chickenpox and shingles. And person-to-person transmission occurs by direct contact with vesicular fluid from patients with either condition. And chickenpox may additionally be transmitted by airborne spread from respiratory tract secretions. And there is a risk of infection up to 21 days after contact. Chickenpox is a highly contagious viral illness, usually occurring in epidemics, and is generally a benign, self-limiting disease in immunocompetent children, but tends to be more severe in adolescents and adults, and also in immunosuppressed patients. For example, patients on steroids. Complications include bacterial superinfection of skin lesions, pneumonia, central nervous system involvement, acute cerebellar ataxia, encephalitis, also thrombocytopenia, and other rare complications such as glomerulonephritis, arthritis, and hepatitis. Exposure to the virus during the second 20 weeks of pregnancy can result in congenital varicella syndrome, characterized by skin scarring, abnormalities of limbs, brain, eyes, and low birth weight. Varicella infection can be fatal for an infant, and if the mother develops varicella from 5 days before and also 2 days after delivery. Shingles presents with skin lesions in a dermatomal distribution, and also in immunosuppressed or immunocompromised individuals, but can be very extensive. It may be complicated by pain persistent for weeks to years after the infection, as post-herpetic neuralgia. The main causes varicella or herpes zoster virus, that's varicella zoster virus, as symptoms for chickenpox, fever, malaise, anorexia, headache, itchy skin rash. For shingles, painful rash, and also fever. The signs that are usually elicited for chickenpox are vesicular rash, eventually becoming crusted, as rash in different stages, as papules, vesicles, crusted lesions. Also appear first on face, scalp, or trunk, and spreads to the rest of the body, more concentrated on trunk, and persists for 5 to 7 days. Also, the presence of pus in lesions suggests secondary bacterial infection. The signs for shingles are vesicular rash along a dermatome, and rash eventually crusts. Investigations, usually none, and diagnosis is mainly clinical, but polymerase chain reaction, as PCR, or cell culture from vesicular fluid, crust, saliva, cerebrospinal fluid, or other specimens may be required if diagnosis is in doubt. The main treatment objectives are to relieve the intense itching or pain, to prevent or treat secondary infection, to prevent dehydration in children. Non-pharmacological treatment: avoid scratching, regular bathing with soap and water, and also avoid intentional breaking up vesicles. Pharmacological treatment: to relieve pain and fever, first line treatment, give paracetamol oral 500 milligrams to 1 gram 6 to 8 hourly for 3 to 5 days. And children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly for 3 to 5 days. And then you can give 120 to 250 milligrams 6 to 8 hourly for 3 to 5 days. That's for children 1 to 5 years, and 3 months to 1 year. You give 60 to 120 milligrams 6 to 8 hourly for 3 to 5 days. To soothe the skin and relieve pruritus, they give calamine lotion or cream topically. Apply liberally to the skin. And also you give cetirizine oral in adults 10 milligrams daily. In children 12 to 18 years, give 10 milligrams daily. 6 to 12 years, give 5 milligrams 12 hourly. 1 to 6 years, give 2.5 milligrams 12 hourly. Or you can give promethazine hydrochloride oral as a sedative in adults 25 milligrams daily or 8 hourly daily. Or you can give chlorpheniramine maleate oral in adults 4 milligrams daily or 12 hourly daily. And in children 6 to 12 years, give 2 milligrams 6 to 12 hourly daily, a maximum of 12 milligrams daily. And 2 to 6 years, give 1 milligram 6 to 8 hourly with a maximum of 6 milligrams daily. And 1 to 2 years, give 1 milligram 12 hourly. Well, antiviral therapy in immunocompetent individuals for post-exposure prophylaxis. Give a cyclovir oral in adults 800 milligrams 4 to 6 hourly for 5 days. In children 20 milligrams per kilogram 6 hourly, the maximum of 800 milligrams 6 hourly. Antiviral therapy in immunocompromised patients, for example HIV. You add a cyclovir oral in adults 800 milligrams 4 hourly 5 times daily for 7 days or until 2 days after casting of lesions. In children 12 to 18 years, you give 800 milligrams 4 hourly 5 times daily and daily for 7 days, and continue for more than 2 more days after casting of lesions. And also you can give 800 milligrams 4 hourly 5 times daily for 7 days, and continue for 2 more days after casting of lesions. That's in 6 to 12 years children. For 2 to 6 years, you give 400 milligrams 4 hourly 5 times daily for 5 days. You continue to continue for 2 more days after casting of lesions. 1 month to 2 years, you give 200 milligrams 4 hourly 5 times daily for 5 days, and continue for 2 more days after casting of lesions. Superimposed bacterial skin infection in individuals not allergic to penicillins. You give flucloxacillin oral in adults 250 to 500 milligrams 6 hourly for 5 to 7 days. In children 10 to 18 years, you give 250 to 500 milligrams 6 hourly 5 to 7 days. And in children 2 to 10 years, you give 125 to 250 milligrams 6 hourly 5 to 7 days. Less than 2 years, you give 62.5 to 125 milligrams 6 hourly 5 to 7 days. Or you can give amoxicillin clavulanic acid oral in adults 625 milligrams 12 hourly for 5 to 7 days. In children 10 to 18 years, give 625 milligrams 12 hourly for 5 days. and 6 to 10 years, give 457 milligrams 12 hourly for 5 days. 1 to 5 years, give 228 milligrams 12 hourly for 5 days. And superimposed bacterial skin infection in individuals allergic to penicillin, give azithromycin oral in adults 500 milligrams daily for 3 days. In children, 10 milligrams per kilogram body weight daily for 3 days. It's not recommended for children less than 6 months because of the risk of pyloric stenosis. Referral criteria: so refer when severe complications setting. Also refer patients who are at risk of developing a disseminated rash. For example, patients on steroid therapy and other immunocompromised states, and newborn whose mother has had a recent infection.